Dr. Jason Litner of Profiles Beverly Hills. We're going to talk a little bit today about revision rhinoplasty. Now, revision rhinoplasty holds a special passion for us, and it's really a very large part of our rhinoplasty practice. Today we're talking about some of the problems that we see with revision patients, and unfortunately we tend to see a lot of the same sets of problems crop up in patients who've been unhappy with previous rhinoplasty surgery. A lot of this is within the control of the surgeon and has very much to do with the particular techniques that were used previously. We'll talk about some of the problems today with a specific patient that we're planning on doing a revision, and a lot of these problems can be attributed to over-aggressive techniques, over-aggressive cartilage removal and taking down too much of the bone from the bridge of the nose. This can result in a patient who for 6 months or a year might be quite happy, but over time we tend to see problems related to scarring, problems related to loss of support of the nose that can affect both the way the nose looks and breathing. A lot of the common complaints that we see are a nose that's twisted, a nose that looks a little too scoopy, that looks unnaturally narrowed or pinched, and that can result in unnatural buckles or changes in the surface appearance of the tip especially. We're going to talk to you about this related to one of our patients and what our plan is to fix these problems.
Hi, this is Dr. Peyman Solieman of Profiles Beverly Hills. Today we're going to go over Daisy, who's one of our patients upcoming for rhinoplasty. She's had previous surgery done about 7 or 8 years ago in the South, and she's come in with some of the more common problems that we've seen over and over again with a lot of our patients. So we wanted to go over some of her images, show what's gone wrong, and then sort of show you in a graphic way in our imaging how we correct that and what things you can expect with surgery. When we look at Daisy, we see that she's actually a very beautiful girl. She's got beautiful eyes, but one of the things that's very distracting for her is her nose. And what we see is a couple of the more common issues that we find with people. One, the overall effect of what's happened with surgery is it makes her nose look like it's tilting to the right. You can see that the natural line over here sort of breaks apart here, and what a lot of people complain about, which is an inverted V deformity. And what happens with a lot of these patients is that it's not only a cosmetic issue, but they also have problems breathing. As we go lower down, what you can see is she's been over-resected. And because of that, because some of the cartilage was taken out, you see what are called bossi. A lot of patients come in and they don't know what these things are and what happened to them. But what happens is the cartilage itself is unable to support the skin envelope, and as a result, it buckles, and what you're left with is these knuckles of cartilage that show through. And that's what one of the major things that Daisy complains about. When we then go over to her profile view, which a lot of patients come in complaining about, what we see is that the overall effect of what happened with her in surgery is because they were unable to actually deproject the tip. The deprojection is the distance from here to the tip point itself. Because they weren't able to reduce this, a lot of surgeons end up over-reducing the bridge itself, and because they're not reducing this, they're left with a real scooped out look. And on Daisy, we see that from side to side, both sides you really see that she was really scooped out, and the tip itself is a little bit over-projected. And one of the main views that you really see that in is in this 3/4 view. You really get that slope sense. And the other thing you also can notice here is this cartilage. If you see this highlight point, that's where that cartilage is buckled, and because of it, it's pointing through the skin, and it shows very regular in real life as well as in these pictures. So what we really want to do with Daisy is go over some of the images. What we've accomplished here, and if you follow a natural line, it should come down and then go to a highlight point, come down in a natural line and really come to a point. And as a result, she's no longer having that twist to her nose. She's much straighter, and her overall inverted V problem that she had before is now gone. There's a lot of things we're going to do surgically to affect that, but when we morph, again, if you go from this view where this is where she's at to what we're trying to affect, you see that the bones have to get shifted over and the tip has to really be brought into balance so that she goes from here overall where she's twisting to the right all the way to a straight, natural look. And when we see her at this point with this sort of look, you're no longer even going to notice her nose, because the only times we see a nose is when there's something off. Here you're drawn to her eyes, which are really quite stunning. When we then go over to her profile view, again, I'm going to show the morph effect of what we can accomplish. Is right now the tip is over projected. If you just bring her tip back, you can see she's left with a straight nose it's smaller nose and it more naturally fits her overall look, but she no longer has that scoop look, which is really an unnatural look, and we really steer patients and people away from that look nowadays. We'll go over to the next view as well, and you see the same sort of effect on the other view, so we'll go quite quickly here. You see on this view from side to side, people are going to be a little different, and again, if we deproject without touching the bridge at all, you're taking away that scoop effect. You can make the nose look a little more lengthened while dropping the tip itself. And overall, it's a much more natural look. It fits her face much more beautifully. So when we look from side to side, you can see again, we're going from one side to the other, that she's left with a real natural look. All the little intricate cartilage knuckles and inverted V problems that we see previously are gone in the after effect. And again, when we go to the profile view, she's left with a real natural look. Really, the point of rhinoplasty and revision rhinoplasty is to get people to a place where you're no longer looking at their nose and seeing any discrepancies or differences. It's really to draw the attention and focus of you away from the nose, because it's so natural to your face, so that you can focus on beautiful things like Daisie's eyes. Thank you. So for Daisy, as with all our patients, Dr. Litner and I will work together all the way from the beginning initial consultations through surgery, where we work together in the operating room to make sure she gets the best result possible. It really helps to have two detail-oriented surgeons on either side of the patient to make sure that all the little differences on side to side are really taken care of, so that the long-term results are natural and give her the best possible option for an optimal result.
We're really excited for Daisy. We're looking forward to seeing these images come to life. So tune in for our next video, where we're going to show you the early post-operative result and see how great she looks.
Thanks a lot.
Thank you.